What kind of surgery would be best to remove under-eye puffiness? My eye bags get really puffy when I smile. Otherwise, they look relatively fine, but I get really insecure when I smile in public. Eye creams don't decrease the puffiness due to the fact that these eye bags are unfortunately hereditary. I am about to be 20 and I am serious about getting surgery as soon as possible, but I need to know which surgery would be the safest, as well as which doctor I should see.
Thank you for your question. You're about to turn 20 and you're bothered tremendously by the puffiness under your eyes when you smile. And you've submitted two very good photos of close-ups of your eyes at rest and smiling. And you've already figured out that the under-eye creams don't work and you are prepared to have surgery. So I'm going to explain to you what the situation is to give you a little bit of sense of my background. I'm a board-certified cosmetic surgeon with a background in oculofacial plastic surgery. That means I trained in eye surgery and then did specialty training in eyelid surgery. And so in terms of the universe of doctors who do eyelid surgery, people with my background tend to be the ones who are the go-tos for complications and complex surgeries. So I'm going to teach you a little bit about, and I just also to further mention that I've been in practice for over 20 years in Manhattan and Long Island. This kind of concern does come up in our practice fairly routinely. And I'll explain to you the basis for what you are seeing. When your eyes are at rest, there's no evidence of any puffiness under the eyes. There's no bags, the skin looks smooth, everything looks good. And then when you smile, there's a bunching up. That bunching up is a muscle, and that muscle is called the orbicularis oculi muscle. This is a muscle that naturally contracts with facial expression and movement. The reality is that there is no surgery to deal with that activity. That especially when you're this young, it is not advisable to do any type of procedure for something that is dynamic. When I say dynamic, I mean with movement. As surgeons, we deal with puffiness under the eyes, but that is puffiness caused by lower eyelid fat prolapse. That means this is fat that's always there. It may look better or worse with smiling, but the fact is it's an anatomic issue that we can fix. And the results of under-eye bag surgery can be quite dramatic. But in your situation, this is the activity of a muscle. So it's like your bicep curling. When you do a bicep curl and you squeeze that muscle and the muscle expands. That's the same thing that's happening under the eyes. Now there have been some patients who we have done low-dose Botox injections and they've seen some benefit. But this muscle is very important. It's very important in terms of the support of your under eye. So the eyelid position is very dependent on the baseline tone of this muscle. Over-relaxing this muscle can cause sagging. And again, at your age, it is probably not the best idea to do Botox injections. I think that just as aside from the surgical or medical aspect of your examination, I would say just from a maturity standpoint, this is a time in your life where you're probably being very critical as most of your peers are doing the same thing. And as we get older, we realize when we look back that we looked pretty good back then and kind of miss it. So I think that you should avoid doing anything at this point, except a lot of times it's very healthy to accept that certain things are just part of the character of your face, but just again to summarize what I'm saying. This is a muscle, it's not fat pockets, and there is no surgery to treat this that would be of value, that would be worth the risk, from my opinion. So I hope that was helpful. I wish you the best of luck. And thank you for your question.